Hi, Dr. Turowski here. I would like to talk to you about the labioplasty and vaginal rejuvenation. This is something that is relatively new. New meaning 5-6 years maybe. Interestingly, before that, nobody was really addressing these issues. However, once we started dealing with these problems that a lot of women have, it became actually a very popular procedure. For me, it's something that I do routinely, hundreds by now, so it is a very routine procedure. However, it can be done in many different ways, and you have to be aware of different approaches because that may change your life forever. What's the most common reason to perform labioplasty? It's addressing of the stretch out or the large size of the inner labia. Inner labia are inside of the vulva that a lot of women don't like that part of that labia is sticking out. Sometimes it causes discomfort. Sometimes it's just the visual situation. Sometimes it's an excess amount of the hood around clitoris. So all of this can be individualized depending on what you have and what your expectations are. Why is this procedure so popular suddenly? Because everybody can see the pictures. You can go on the internet, see pictures of other women, you compare it to yourself, and you can see that maybe you are different, and maybe you want to look different just like your nose is different, but this is of course much more visible. So this is my reasoning why we suddenly see a lot of this operation. Now, it's a very good procedure. One thing, it can be performed under local anesthesia. Surprisingly, a lot of women go for it. They don't want to be asleep. They want to drive themselves in and out. They don't want anybody involved. And with the proper local anesthesia and proper even laughing gas, if you want that, it can be easily addressed like that. Very rarely I actually use general anesthesia to perform this procedure, but of course for those women who are afraid and who are anxious enough to have that, no problem. We can address it through the general anesthesia. Once you are injected, absolutely no pain. That's the nice part about it. That's why local anesthesia is so good for that, because once you inject it and it takes a minute and 2 minutes, there is no pain. You're just laying there with the nurses and me in the room, and it's kind of like a GYN exam that you go through every year or more often. How do I address it? There are two ways to address it. One is so-called amputation. When you actually perform the procedure vertically, you amputate the excess amount of the labia, and it really takes care of the problem. The problem is that you are creating a raw surface, a scar that extends throughout the whole vagina, up and down, with a discoloration, because the colors are different on the surface and inside, and you're actually cutting off all the nerve endings doing that. So your labia may become completely numb and you have a different sensation. Also, the scar may be visible. The other thing that happens a lot, and I see it presented at the meetings, at the other patients that come to me for the revisions, is that the labia can look amputated. They look like they're actually not there, because initially they're swollen, but once they shrink, they completely retract and they become invisible. That's pretty much irreparable. It's for life. Therefore, I don't do that. We actually do a different approach that some doctors do and some not. We do so-called wedge excision. So the incision is not done in this fashion, it's done in this fashion. So the wedge of the labia is removed, and then the labia is put together. So the nerve endings stay, the color stays, and the scar, instead of going up and down on your vagina, it goes inside the vagina. So it's pretty much invisible, to the point that I think that most of the patients that I operated on, even if they are examined by GYN doctor, they probably will never know, because it heals so well. So what's the procedure? You do it under local or not, if you prefer to do so. You go home. There are no stitches to be removed. So if you're far away, you don't even have to come back to see me. Of course, we are here for you. If you have concerns, issues, send the pictures, call us. I'll be happy to talk to you. Go through your recovery. What are the limitations? Very minimal for the real life. You are going to go to work in a couple days. The only limitation is not to have sex for 6 weeks. So no horseback riding, no anything that puts the pressure on that area. should be avoided for about 6 weeks. After 6 weeks, you can go back to full life. So if you have any questions, I know it's intimate and it sounds maybe not so comfortable for some of you, but you can send me pictures. It goes to the private email. Nobody will see it by me, and I can give you estimate. I can give you directions. We can talk over the internet what needs to be done in your case, and you can come just for the procedure, sometimes even the same day, and leave the same day. And we've done it a lot of times.